Hi, I'm Carolyn Grimes with the Plastic Surgery Channel, and I'm here with Dr. Bill Adams, a world-renowned expert in breast augmentation. Dr. Adams, what's the procedure you're about to perform?
Well, we're going to be doing a augmentation with a breast lift on a patient who's had some children and wants to restore her breasts back to like they were before children.
Is this a procedure that she was real concerned about pain?
Yes, actually, most patients are very concerned about pain. That's probably their primary worry about having surgery. So she's concerned about that, and we've discussed with her the things that we'll do to minimize pain.
What specifically do you do in surgery to help alleviate pain?
Well, there's a number of things that we can do, but one of the things is just handling the tissues atraumatically. So there's a lot of surgical technique that really contributes to minimizing the pain, but also selecting the right procedure for her, the right size implant. So all of that minimizes pain. We also will use some medications that can be injected to help minimize the pain after surgery. So all those things taken together, she should have a relatively painless procedure postoperatively.
Dr. Adams is not alone. We interviewed numerous plastic surgeons that say pain after surgery is a big concern for patients.
All patients have anxiety about pain, and really it keeps some people from having a procedure.
Not being able to move and being in bed for several days and, not being able to go along with my daily routine.
A tummy tuck or abdominoplasty is known to be one of the most painful plastic surgery procedures. However, a surgical injection for pain at the time of surgery helps in the recovery process.
The newer agent is one called Exparel. It's a numbing agent that is in a sustained release formulation. So we put it into the surgical site, it releases over 3 days, and that's really the critical period for people.
My life did not change once I got home.
And you have
Absolutely.
You have two small children.
I have two small. I have a 2-year-old and a 5-year-old.
Surgeons say numbing agents can reduce the need for the majority of narcotics that are normally prescribed after surgery.
As far as recovery goes, I only took the pain meds so I had surgery on Monday, so Monday and Tuesday. I was back to work on Wednesday, just taking some Tylenol throughout the day.
Less narcotics is good news for the patient. Painkillers can have side effects such as nausea and constipation.
If you can keep someone out of pain for 2 to 3 days after a procedure, or significantly decrease their pain for that 2 to 3 days, it makes their whole healing course much, much better.
Dr. Steve Finnickel says he uses Exparel in his tummy tuck surgeries.
What have patients come back and said to you?
The real difference was they came bounding down the hall. They were standing upright instead of being hunched over and guarded, and were breathing easy, talking normally, very comfortable to have their dressings changed. And those are things that you just see a big difference between having that on board and not.
Carolyn Grimes, the Plastic Surgery Channel.